Good morning. Good morning, everyone. We're going to get started. Please take your seats. All right. Welcome to our annual Define Forum. I am so excited for today, one of my favorite days of the year. My name is Susan Huang. I'm one of the neonatologists here at the Anschutz Medical Campus, passionate about equitable engagement of families in our NICUs here on this campus as well as across Colorado. And I thank you all for coming today. I know that none of you are doing this work in a paid way, that this is added passion and responsibility to your already very full professional bandwidth. So I really thank you and appreciate all that you give to our babies and our families. Let me start off with some acknowledgements. These are the folks that you see outside there who have really worked tirelessly to make this forum happen today and then for every day. So please, if you see these folks out there, they all have name tags, please give them a big hug and say thank you for making all of this possible. We have a great agenda for you today. We're taking a bit of a different format. The first that I'll highlight is that we are entirely bilingual today. This is the first time that we are trying this, and I'll provide a few more details in just a bit. So that's the first big change. The second is that we have taken your feedback that you've provided in prior years and integrated it into today's agenda. What we kept hearing is that you wanted more time to talk and discuss the content that you were learning and strategize ways that we can integrate that into our daily clinical lives. And so to that end, we have really embedded lived experience and discussion at the end of each of the presentation sessions. So you can see here that we are starting off with a keynote from Dr. Gabby Cordova Ramos. We'll have a lived experience expert presentation, and then we pause, and within smaller groups, we integrate and reflect. So this will be the pattern that you'll gain some knowledge. We'll hear from an individual with lived experience, and then in small groups, we will integrate and reflect, with the goal being, what can we learn today that we can apply tomorrow? Okay, and so that will be the pattern. And so let me pause here and allow folks from our Community Language Cooperative to provide details about how interpreter services will work today.
Good morning, everyone. My name is Daniel. I'm with the CLC, and I'm here with my colleague, Ruth. Thank you for providing an inclusive space where everybody can speak with the language of their heart or the language that they feel most comfortable with. Today, we're going to have a fully bilingual event, as already mentioned, and we're going to be doing simultaneous interpretation in real time. What this means that if you're not fully bilingual, I would highly recommend to grab a receptor. That way, when somebody speaking in the language that you don't understand, you can just put that headset on and listen to our simultaneous interpretation. Again, thank you so much for having my colleague and I here today, and we're really happy to practice language justice with you. Now I'm going to say it in Spanish. Muy buenos días a todos. Mi nombre es Daniel Barrón, estoy aquí con mi colega Ruth. Gracias por crear un espacio inclusivo en el cual se practique la justicia del lenguaje. El día de hoy este evento va a ser completamente bilingüe, lo que significa que vamos a estar interpretando en tiempo real, tanto en inglés como en español. Si tienen algún problema con los receptores, por favor déjenos saber. De igual manera les agradecemos practicar justicia del lenguaje el día de hoy con nosotros. Muchísimas gracias. Thank you.
The day is just starting and already I feel like crying. That was amazing to hear an entirely different language, allowing for really a welcoming space. That's the first that we've done that. This is, the first time we're trying out really a bilingual forum. And so I think it's incredible. All right. So, for the past several years, since Define first started, this is way back in 2019 before COVID, I had shared our working definition of family engagement that came from AHRQ. And that definition highlighted what engagement looks like at individual, unit level, systems level, community level. And I was curious to see if the definitions, public understanding of family engagement may have changed in the 5 years that Define started. And so I thought I'd use AI, because AI, as you all likely know far better than I, gathers from data sources that exist out there in the broader world and synthesizes it into trying to answer the question that you pose. And so the question that I asked was, what is family engagement? And here's the definition that actually I was very happy with. Family engagement in the NICU is when parents and other family caregivers are included in the care of their newborns. This can include being present, holding the infant, and participating in activities that support the infant's development. Family engagement can have positive outcomes for both the infant and the parents, such as improved attachment, reduced stress, improved developmental outcomes. Pretty good definition. And so I felt so encouraged, because this is what's available in the public space, in the lay public, not the hospital, healthcare-based, kind of participation, audience members, but really this is public understanding of what family engagement looks like. And I felt very reassured by that. Now, what's not highlighted here are what are the broader factors, community level factors, state, federal, legislative factors that impact our ability to get to this point of family engagement. And so today we'll talk about individual level things that we can do to support families, but also broader systems, interventions that we have to think about that are beyond our NICU. As always, I wanted to share a brief data summary with you. This is just a snippet of the data that we collect for the Define Collaborative. I'd like to acknowledge the 7 hospitals listed here who've contributed data. You can see the numbers really range based upon the census, the volume, and eligibility criteria across these NICUs. But thank you, those that enter this data from these 7 sites. Shown here is our response flow diagram. You can see that 739 parent-infant dyads were enrolled. Around the time of enrollment, we ask the caregiver to complete the initial survey, and we have a bit of a drop-off, so we have 483 survey completions, and then post-discharge, we follow up with the survey, and you can see this is where the big drop-off happens, where we go from 483 to 178 post-discharge surveys completed. Now, alongside that, we ask the healthcare team identified as the data enter to also abstract some chart data. And that number is fairly robust at 570. So clearly this drop off from enrollment to post-discharge requires additional work, and know that we are actively investigating more creative approaches. One is moving away from email and perhaps more going towards texts for survey completion, which we've learned from some sites leads to far higher response rates. We collect some limited socio-demographic information on them, as well as families' experiences of various social determinants of health. And that's really what I want to focus on, because while we will absolutely learn individual level approaches to better supporting families, we recognize that these families are experiencing far more than just what we see in the NICU. And so here we see the preferred language that parents have noted in the surveys. 86% report English as the primary language, 14% as some other combination. In terms of infant insurance, it's about half-half. About half are publicly insured and the other half private. Race ethnicity, for some time, if you can recall that we were pulling race ethnicity data from our electronic medical records, comparing that to parent reported, and we found that in fact it was not always concordant, highlighting the probably lack of reliability to some extent around race ethnicity data in our EPIC or EMR systems. So for parent reported race, the other thing I'll note is that you can see differences in terms of what parents report as their own race versus their infant's race. And so that being said, we have 22.4% of our families reported as non-white. And then in terms of ethnicity, 27.5% are Hispanic. And I want to highlight that this is different than our general birthing population. We are an ethnically diverse state in terms of about a third of our birthing population identify as Hispanic. But in terms of racial diversity, I would say less than 5% identify as non-Hispanic Black, less than 5% identify as Asian Pacific Islander. Thus, in our NICUs, as is not a surprise, we have an overrepresentation of racial diversity in our NICU, really mainly driven by the fact that there's far higher preterm birth rates in our minoritized populations. We ask families about parental burdens that they may be experiencing. And you can see that the top three are bills, at 24% of our families reporting stress from bills, transportation at 26%, and then food insecurity at 21%. So a fifth of our families reporting food insecurity. And you can see that families reporting any challenges in the NICU, this has changed over time. Now, I'm not quite sure what to do with this run chart, except to say that it's not uncommon, right? For the majority of the families across these time periods, they're experiencing some sort of burden, that's social, financial, or otherwise. And so we're here today because we want to do something about it. And sometimes when we think about these broader structural community level things that are barriers to optimizing family engagement and bonding, it can feel overwhelming because what can we do in our individual roles, in our individual NICUs? But truly today, I hope that we learn, we apply, and we improve. And so the do something phrase, it comes from Michelle Obama at the most recent, debate. The Democratic National Convention, where it feels like too much sometimes, but let's just go out and do something. And so today we're going to learn about how we can advance language justice, how we advance our mission through policy and advocacy. And we want to and should listen and learn from the local hospital. So the afternoon time will be spent with hospitals presenting their own engagement efforts. And then finally, and probably most importantly, listening and learning from those with lived experience. What is their perspective? What is their experience? I think that's really the most critical piece. And finally, I'll add, for those of you who represent NICUs or other facilities that are not yet engaged in Define, please reach out to me, reach out to anybody out at the front, and we can provide additional information about how you can get involved in this effort.